family planning majorly for the women. What happened to the men? They are the ones impregnating the women. So why can't they go for the family planning? Why can't we look out for different family planning methods for these men? But we realize that it has lots of benefits for the women who are carrying the pregnancy.
That is a good question, actually, because when you talk about family planning, usually it's all about the woman. The focus is on the woman, as if it's only the woman that is supposed to be doing family planning. And when we talk about family planning, it's also has a lot to do with birth control as well, right?
Yes.
So, but the focus, why is it that the focus is always on the woman when it comes to family planning? Why not the man? And who should really take on the responsibility of family planning? Is it just the woman alone, or should it be the woman and the man?
Well, for that, it should be both the man and the woman.
Okay.
But because the family planning that we have is majorly for women, then the women should take cognizance of the type of family planning that will suit their body. Talking to their health workers, we shouldn't be afraid to speak to our doctors, to speak to those people to help us with the right family planning.
Yes.
If we look at it as my husband does not like family planning, then we tend to produce children more and more. So this is one of the reason why family planning has been the major concern from 1972. And with the record, they realized that from that 1972 till date, they have been able to curb so many unwanted fertility. Then women who have issues with child spacing, they are able to make use of family planning to space their children. And so, most importantly, when we say the couple, like I mentioned earlier on, the woman's health is dominant in all ways, because if the woman goes through the pregnancy for 9 months, after pregnancy, immediately she's back home.
Yes.
Within some husbands don't even wait till the regular 6 weeks postpartum before they ask for sex again. And this period is a fertile period for women. So if a woman goes in and she gets pregnant again, it will affect her health, because she has a rigorous journey of 9 months going through either the theater or the labor room to give birth to a child, and you're not giving that woman the opportunity to rest the body, the everything internally,
even to heal as well. Yes.
So with that, psychologically she might not be ready, but because of this, men will tell you, oh, if you don't give it to me, then I'll go outside and look for someone else who will give it to me. And as women, we try as much as possible to keep our homes. Okay, fine, let's go ahead and have it. Most women are not even prepared for it, but because they don't want that justification or that talk, I will go outside and have it elsewhere, they will want to satisfy the man. And so it ends up with, sometimes you hear mothers saying, oh, I have 6 weeks baby, I have 12 weeks baby, rather, and I'm pregnant. I realize I'm pregnant again. So it means she started having sex on or before 6 weeks.
But from what you've seen from your experience being a birth advocate, how often do you find men having this understanding about the break that needs to happen, the space that has to happen before they have intimacy with their wives, when it comes to after they've given birth? Do you realize that a lot of men actually have this understanding, or men are not really informed when it comes to that?
Men are not really informed.
Yes.
Let's say just like 30% are informed, and out of that 30% that are informed, we have like 20% scared on behalf of their wives, not adding weight, and some other negative impacts that they've heard or seen about family planning. So they tend to be like, oh, don't worry, I will use withdrawal method, forgetting that anything can happen even if you are trying to use withdrawal method, because withdrawal method is not known to be 100% safe.
Yes.
So then another thing is, men also look at it from the perspective of, some men actually look at it from the perspective of, oh, I want us to do this thing very fast. Like, let's give birth to all the children we want to give birth to now. Then after that, we can now rest. Forgetting the body of that woman also needs to rest, also needs to relax, to heal before going in for another pregnancy, taking in for another pregnancy, and then caring for another baby.
No, you can either, give birth through either CS or vaginal method. Now, do the times vary before a woman is supposed to be, after giving birth, before a woman can be intimate with her husband, between the two delivery methods?
Okay, yes.
Okay.
For a vaginal birth, actually, for vaginal birth and cesarean section, you are advised to wait for 6 weeks. Why? The 6 weeks is to help, like I said before, the woman's body is fertile. So for the body to relax, to heal, and also for you to prepare to go for a family planning.
Okay.
Because by 6 weeks, when you go in for your postpartum checkup, your doctor will be able to advise you on the different types of family planning that is available. Then your doctor will be able to work with the one that will suit your body the most. Because you can't just jump on any family planning. Oh, because my friend is using this and she's not experiencing this, I can also go for that same one, and then I will not experience such thing. So when you work with your doctor, then he or she will be able to advise you on what to do. So it is wait for 6 weeks.
But for both methods?
For both methods.
Okay.
Now, for vaginal birth,
okay,
some mom look at it as, oh, I'm ill, so I can go ahead and have sex. But for cesarean section, realize that within that 6 weeks,
yes,
you are not only healing from giving birth, you have layers that have been cut open.
yes.
So with this tissue, all these layers cut open, you need to allow it to heal properly.
The pain as well.
The pain as well. So, and if you are not careful, the pain will come back again, and the incision area can open again. So you going back to the hospital for stitching it's something that will be so painful and very difficult. So it is advised that you wait for 6 weeks, and also you need to be psychologically and emotionally ready. It's not just about, I want to start having sex, or my husband wants sex and I just want to give in. There are some women that at 6 weeks, they are not psychologically and emotionally ready. So they also need time to get ready for that. And there are some women who go through postpartum depression.
Yes.
During postpartum depression, the last thing on their mind is sex.
Yes.
So it's just trying to come out of that depression, taking care of herself as a new mom and also a baby. So it is best advised that you wait at least 6 weeks, first to avoid another unwanted pregnancy,
yes,
as early as that. Secondly, to heal very well. And thirdly, to be able to pick the right family planning when you go for your postpartum checkup at 6 weeks.
Yes, thank you. Now, what are some more benefits of family planning, and how can it improve a woman's health?
Okay, so we have so many of that. Number one is family planning could prevent illegal abortions.
Illegal abortions?
Yes.
Could you please explain that?
Okay,
yes.
When women get pregnant and they don't want this pregnancy, they end up going about on how to abort the pregnancy. So it's illegal because there is nobody giving them the right to go ahead. Is it affecting your health? No. Is it affecting anything is it affecting your health as in physically, emotionally, psychologically? It is not. And you want to go ahead to abort just because you don't want. Generally, worldwide, realize the analysis says that we have over 50,000 abortions daily. So if there is over 50,000 abortions daily, out of that 50,000 abortions daily, like 70% happens to be unwanted pregnancy. So if you are on family planning, then you wouldn't have that unwanted pregnancy. Is family planning 100% safe? No. But at least to some extent, to 90-95%, you are safe. And you can also help yourself to be on the safe window.
Yes, yes.
So that's about the illegal abortion. Then another thing is it will also, the maternal mortality rate is very high worldwide, and according to the according to what we have, you know, the goal, the Sustainable Development Goal 3 talks about well-being and the health of everyone in the world. And so with that, we also have the maternal mortality rate, how we are going to reduce maternal mortality rate. And in the world, they are saying that it should be reduced to 75 deaths in 500,000 births. So if this is going to happen, then when we have family planning in place, it can reduce it by 25%. According to researchers, that it can reduce it by 25%. So with this 25%, it is significant enough for it to be reduced. If we remove 25% from 100%, we have 75%. Then we can now work on other causes of this maternal mortality rate. We have other causes like rejection of cesarean section birth, nutrition, and more like that. So, but we are focusing on family planning. That's why I said 25%. It will help reduce it. Another thing is it helps physical and mental well-being of the woman. You know, a woman that is not ready for another pregnancy, or a woman who has a 3-month-old baby, and you ask the woman and the woman realizes that she's pregnant. Physically, she will not be fine. Mentally, she is not stable. She will not even be able to take care of the baby at hand because she will be thinking about what has happened. She's trying to come out of the trauma of the last pregnancy. And sometimes when you have a very, very, let me say, wonderful experience with the last pregnancy, then you will be scared of going in for another pregnancy. So with this, if family planning is in place, physically and mentally, the woman will be stable. The woman will also have opportunity to breastfeed the baby at hand more if on family planning. Why? Because there is a myth behind breastfeeding while pregnant. Our mothers will tell you, when you breastfeed that baby will not be able to walk very well. The baby at hand will not be able to do this. The baby at hand will become very sick, which is myth. But many people do not know that. So before they get to know that, I can be pregnant and I'll still be breastfeeding, they have already stopped their baby from breastfeeding. And so by the time they get that knowledge, they will not be able to go back to breastfeed their baby. But when they have this knowledge, and they also go in for family planning, they will be rest assured that, as I breastfeed my baby, I am safe with my family planning. So that's another thing about the benefits of family planning.
And before you move on to more benefits of family planning, how much space should a woman give between her children, between having more children? Is how many years should there be in between a child when it comes to family planning?
All right. So for I would say for cesarean section, doctors advise that you wait for at least 18 months. 18 months to 2 years. This is to help the body get back to its normal position. You are healthy. The cord is properly healed from internal out, and then you yourself, you'll be physically, psychologically, and emotionally ready for another baby, to take care of the next baby. You know, our toddlers are very wonderful, hyperactive. So if you are not careful, you are pregnant and you have a toddler that is very active, you end up stressing yourself the more, and then the scar will definitely ache or pain you most often. So for vaginal delivery, I would say wait for 18 to 2 years too. Because that way, you know that by 2 years, you can send a toddler to crèche, to school, to just learn for a few hours. Those few hours, you can have things done, or you are also at the office, you need time to yourself. You need me time. It's not always about being in the office. There are times you are at home and you need me time. You also run a business from home. You have time to take care of yourself, take care of the pregnancy, go for your classes, and then also prepare to take care of the toddler.
Thank you. Yes, you can call in on 07000 917 917, 07000 917 917. If you want to make make comments, you want to share your own views, your opinions on what we're talking about, or you have a question, go ahead and call on 07000 917 917, 07000 917 917, or send a text or WhatsApp message to 070 317 56537. Now, for women that have concerns about family planning, before we go ahead on more benefits of family planning, for women that have concerns about family planning, like the side effects, because some women to complain that it makes them gain weight or it could cause bleeding and all that. What would you have to say to women who have concerns about that and they'd rather not even venture into doing, they're afraid of doing family planning as a result of that?
Okay, so I will say that, like I mentioned earlier, you should talk to your health worker.
Okay.
That's your doctor, most importantly. And I always prefer to talk to a gynecologist. You know, a gynecologist deals with women. So he or she knows what to look out for, how to go about this family planning.
Yes.
Now, if you are going in for family planning, please go for the one that suits your body, your hormones. You cannot just go for anyone just because a friend or your church member or your mom told you this one is the best. Seek medical advice.
Okay.
Now, because if you don't do that, you just go in, you think the hormonal is good for you, and your hormones react to that, then you might end up bleeding or bloating,
Yes.
gaining weight, which might result to you even going into depression. Because, for example, you are someone that is on.
We have a call coming in. Can we just pick up this call? Hello. Hello.
Hello, good afternoon.
Hi, good afternoon. What is your name, please? Where are you calling from?
I am Mrs. Esas, calling from Ikorodu in Lagos State.
Mrs. Esas, thank you for calling in. Please go ahead and ask. You have a comment? Go ahead, please.
Yes, I want to ask a question because there are people like my first child when I was breastfeeding all through until 2 years before I went in. There was no like I was not menstruating, so all through that period, there was no need that I could be pregnant. But I noticed that after I went in, afterwards I had my period and I was pregnant again. So I just want to ask: are there cases where people who are breastfeeding and they are not seeing their period, can they still be pregnant?
Okay. All right. Thank you very much for your comment. Thank you so much. We'll go ahead with the answer now.
Okay.
Yes.
For that, if you are breastfeeding and you are not seeing your period, that does not mean you are not ovulating. Now, we should know that ovulation occurs 2 weeks before menstruation. Now, if you ovulate and you have sex at that period, you can get pregnant before next menstrual cycle. So sometimes mothers who are breastfeeding, because they've not seen their period, they may not even know that they are pregnant just because they have not seen their period. But they don't know that they are already ovulating. So there are some women who do not know how their body reacts when they are ovulating. There are some women who are more horny when they are ovulating. There are some who goes through pain when they are ovulating. There are some who kind of, they just want to be alone. They have this mood swing during ovulation. So you need to know what happens during your ovulation. You need to monitor it for at least 3 to 6 months and know that, okay, this is what happened during my ovulation. So if a woman is breastfeeding and she has not started menstruating, is she ovulating? If she is ovulating, definitely pregnancy can occur. Except she's not ovulating. If she's ovulating, pregnancy can occur. So like she said, she weaned her baby and immediately before her next period, she realizes that she's pregnant. It's because immediately after she weaned her baby, the breastfeeding helped her as a form of family planning. And immediately she stopped breastfeeding, her ovulation started. So immediately the ovulation starts, definitely if she has sexual intercourse, she can get pregnant within that window, fertility period. And so when she's pregnant, definitely she will not see her period, the next period, because pregnancy will stop the menstruation.
And so the fact that you're breastfeeding and you're not menstruating doesn't mean you can get pregnant.
No.
Okay, thank you very much. If you have questions, please call on 07000 917 917 07000 917 917, or send a text or WhatsApp message to 070 317 565 37. We're about to round up on the program now. Yes, can you just go ahead and just share with us your final words on this topic right here? How family planning can improve a woman's health as we sign out on the program.
All right, thank you very much. So another thing is family quality of life of children in the family. Time to take care of their
We
needs.
have another call coming in.
Okay.
Just pick up that call. Hello, good afternoon.
Hello, good afternoon.
Hi, good afternoon. What is your name, please? Where are you calling from?
Yeah, my name is Blessing.
Okay, nice to hear you and have you calling. Oh my goodness. Please call in if you can with that before we sign out on the program. 07000 917 917 07000 917 917. Please go ahead.
Okay, so like I said, you have enough time to take care of the children
Yes.
at hand. You also have opportunity for vocational development, taking care of your own personal needs, developing your career, growing your career, your businesses. You have opportunity to do that. If I have a baby now and I have my family planning in place, I can always schedule my programs. I want to run a program for 6 months. It will really go a long way to help the woman too. Okay, so another thing is we all know that we have different types of family planning. We should always go for the best according to our doctor, whatsoever the doctor tells us. So I just want to go through that. We have the hormonal, we have the barrier, we have the we have the IUD, which we know as intrauterine devices.
So we have another call. Hello, good afternoon.
Yeah, my name is Frederick. I'm calling from Yaba.
All right, thanks for calling. Please go ahead.
I just want to ask your guest, why is it that do we have family planning for men? Because I often hear people talk about if there is family planning for men, does it have a side effect? I will listen over the radio. Thank you.
Okay, thank you very much for your call. And just a quick disclaimer, she's not a doctor, she's a birth advocate, but thank you for your question. Please go. Do you have an idea of family planning methods for men?
Yes, the only one that is known is called vasectomy.
Vasectomy,
yes,
okay.
And it's it is the tubes that carry the sperm from the testicle to the penis are cut. So when it's being cut, there won't be anything like fertility.
How many men are open to having that done? I don't think we have that many men that are willing to do that. Just few, yes.
That are going in for that. But it's reversible.
It's reversible.
Yes,
okay.
According to what we've heard, it's reversible. But I've not seen anyone that have done it.
Okay.
Let alone reversing it. So
okay. We have another call coming. Let's just quickly pick up this last call. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. What is your name, please? Sorry, what's your name again?
So I have a question for us. It might not be participating on the topic on ground.
Okay.
Yeah, my junior sister, she told me that for past 2 years she has not been seeing her period.
Okay.
And I don't really know. I want the auntie to put me through. And again, this family planning issue, some people like she used to take the family planning, she used to get fatter. So what is the cause?
Okay. All right. Thank you for your question. Thank you for your question. Thank you. All right.
Okay, like I said, if she's not seeing her period, she needs to visit a gynecologist. Now, a gynecologist will be able to help her. It may be that she has hormonal imbalance.
Okay.
So they need to work on that. And then for someone that is getting fat, increasing in weight just because of family planning, if you do not go for the right family planning, you might end up having the side effects. Is there any family plan that does not have side effects? Minimal in different family planning type.
Okay.
So anyone you go for, be sure that it goes with your hormones, with your body.
Yes.
That is why I keep on repeating that you talk to your doctor. Let your doctor be the one to advise you. Then that will be able to help to give you the right family planning that will be safe and effective.
Oh, thank you so much. Thank you, Oluwa Jeremy Adewale, for being on the program with us this afternoon. She's a birth advocate for C-Section Moms Initiative. We do appreciate you being on the program and really educating us on family planning this afternoon. We'd love to have you some more, definitely, on our programs. Thank you. Well, thank you to you too for listening to the big question this afternoon. Remember, this program comes up Mondays to Fridays at 12:15 p.m. Another day will be tomorrow. We'll get to tackle another challenge, another situation, another matter, and so that we can discuss some proper solutions to issues affecting us as a nation and as citizens. Thank you for listening. My name is Temi Tokwe Olulaye. Do have a great day and stay tuned to WFM 91.7.
In fact, it's increasing more. We never had a snake and whether python and swallow money.
Why?
Everything has increased.
Conversational, controversial, and borderline disruptive. The Big Question.
Mondays through Fridays at 12:15 p.m. on Your Women Radio WFM 91.7.